testosterone plus Masteron for libido and positive effects for the central nervous system. This video today is for all of you in the world to understand the truth in modern medicine, clinically, and chemistry of what's happening. And this channel is about androgens. I've seen more and more clinically in my practice, and now that we have Testosteronology, we're working with other caregivers, healthcare practitioners in America and all over the world. I'm seeing more and more of utilizing synergistic medications, androgens, and that's my world. So I always want to be appropriate for harm reduction for everyone and make sure that young people understand the real effects clinically of steroids, and that if you get on steroids, there's going to be effects, but hopefully positive effects, right? If you make your decision to do it in this world, this has to be super progressive and understanding with education, that you understand exactly what is going to happen, the best knowledge and education information that you can get. And I'm so happy and humbled to be part of that life for you.
I'm Dr. Thomas O'Connor, a lifelong powerlifter, board-certified physician, and published academic author. I've taken care of thousands of men on testosterone and steroids, and now I use my media appearances in this YouTube channel to provide education and harm reduction. Subscribe now so I can help you stay strong and healthy.
So testosterone and Masteron, let's talk about it. There's two features really only. If you understand Masteron, DHT derived steroid, you could see I've done two great videos in the past on this. You can see those for the details of the scientific history, manufacturing, the mechanism of action, really into the details and all this stuff. But really what's happening for the crude effects in your brain, this is definitely something that everyone, I think, bro science guys, anyone who's using this is going to agree that because it's a DHT-derived drug, and it's kind of a weak drug, people don't really use it by themselves. The classic bodybuilders have used this with steroids and testosterone, right? So understand that for an enhancement of muscle hardening actions. And that's the inherent anti-estrogenicity of this drug. So remember, we're looking at Test and Masteron for libido. So there's an effect that more men are using this drug, Test and Masteron, instead of AIs. Now, this is bleeding cutting edge stuff today. This is September 2024. More men are getting this memo that they could microdose testosterone for great, long-lasting chronic effects, right? This is me too, after 35 years. And I can love this combination, right? I have doctors that take care of me in parts of the world where this is legal. Masteron is not legal here, but it's legal in other countries. So be careful with that. Don't break any laws, guys. You want to be effective and you want to be sustainable and you want to be a good guy. But you want to work within the confines. The world's opening up, and I'm here to help the world open up ethically. So instead of using AIs to potentially utilize these synergistic combinations to get to a point where the use and the structure chemically of testosterone with a medication like this on the central nervous system effects, there's no question you could not use the AI and use this drug. There's also primabone and proviron. There's no question, but the Test and Masteron is an amazing combination for the TRT guy, not the bodybuilder. The bodybuilder's using huge doses. We'll be going to, stay with me, we'll be going into doses right here in the end of this. So the first effect, again, is the anti-estrogenic effects of synergy, using this with alongside classic testosterone base injections, okay? Mainly injections, no gel and stuff, and the pellets and the oral. It's just not something that, when you look at the sustainability and the mood, real effects of of these drugs. No one's going to argue. The history speaks for itself that testosterone injections, micro injections, are king and never going to be beaten. Not in this next 20 years. The next effect, that's number one. The second effect is the androgenic effects. It's a DHT-derived drug. That's the drug itself. This medication, again, it possesses effects that are from the DHT derived effects into the CNS, okay, with testosterone that can ameliorate the diminished effect of men that are on testosterone. Now I'm losing my sex drive. Listen to what's happening. So many men start testosterone, right? This is the clinical effects that only I can give you guys from the streets of dealing with real men in the streets for decades now. Man starts testosterone plus or whatever the dose, the 200, the 100 every 5 days, the microdosing with the AI, then stops the AI with other medications. And this is not a steroid guy, right? And he's like, I've lost the libido. Then you look at the effects of testosterone and Masteron. So not just hitting the DHT receptors in the brain. I thought I had to bring this to you guys, but we all know, the bro science guys, that it suppresses and competes with the sex hormone binding globulin. So your free testosterone goes up. Now, I'm done. Those are the two mechanisms. That's it. That's the inherent synergy of this Masteron with testosterone is so simplistic, and I do see that it's sustainable. And I think it's not that dangerous, but let's go into the side effects. Obviously, we have to be very, very careful for the side effects. So let's talk about it. The doses, the types of the pharmacology and what's in the real street world for this medication, right? Drostanolone, Masteron, enanthate, and there's also propionate, short acting and the longer acting. That's pretty simple out there. Now, again, like I said before, it's not able to be prescribed in America. So if my patients are watching, and all the patients of all the testosteronologists that we're training and working on, yeah, you're going to be frustrated. You can't get it. And I can't give advice that you're going to get this because it's not prescribable. Even at all the crazy anti-aging places, they'll give you Anavar, they'll give you Decadrobolin, more testosterone than you could possibly ever want. It's because it's America. But in the end of the day, when it comes to this medication, it is legal to get it in different European countries and Asian countries. I mean, it just is. So the world's going to get smaller. We're going to discuss that. We have a private forum for this on testosteronology. Okay, but I'm monitoring that with a lot of other people. We keep that thing super, super tight. Definitely not here to sell steroids or give bad information, especially for the young guys. So let's talk about, this is with testosterone with a base. All the questions for you guys, testosterone base. Again, it's not steroids. We're using the typical, I like that testosterone cypionate or enanthate, or if you're in a European country, Sustanon 250, because it's 250, not 200 per milliliter. You have to use a little smaller microdose. But if you're doing something like the lowest effective dose, like 0.5 of testosterone cypionate, its concentration is 200 milligrams per mil. You're on half mil. It's 0.5. It's 100 every 5 days. That's for me. That's my regimen. It's most of my patients. Probably if I'm gambling, most of you guys. Again, there's no steroid. This is not steroid stuff here, but it does work quite well, right, guys? Because you're going to be training and your heart's going to be good and you're sustainable. You wreck your heart, you're never going to have great muscles. Okay, so what I see, the add-on is, let's talk about drostanolone, right? The generic propionate, the short acting, or I think it's great to have the enanthate longer acting. So it's going to be based on the concentration. What's the classic concentration? You could see it's going to be at 100 milligrams per mil, it's going to be 200 milligrams per mil, or there's this classic combination. Again, I'm here to give you guys really good information here, not advice. This is not steroids, but there's a combination Masteron and enanthate, drostanolone plus propionate 100. So that's drostanolone prop 100, and then it's drostanolone enanthate at 250. Right, so this is a combination. This is a combination of 250. The total is 250. Right, so in this, there's all sorts of permutations and combinations. You have to get something legit. You have to get something legal, and you have to get it together where your dose is going to be appropriate, lowest dose. But the dose is typically with the 0.5 of testosterone, something like a 0.1 or a 0.2, maybe up to 0.4 or 5 of the drostanolone mix that you're going to use. Okay, it's lowest dose. And it's what's amazing about it is that because you're doing such micro dosing and such synergy with this, that you're typically, you don't see toxicities. I'm going to run the ABCDs for you guys here in a minute. You know, the side effects really, and the important stuff is the heart. That's my stuff. I'm an internist. That's really my baby. That's why I'm here today. But when it comes down to these small doses, again, it's the CNS effects. It's that, God, doc, I just feel uplifted. It's sustainable. I feel the sex is crazy. It's really sustainable. In addition to the testosterone, again, be careful, guys. This is fingerprint medicine, man per man. Again, you have to be careful. It could be crashing to you. It could make you anxious. It could make you moody. It could wreck your sex. Every man's different. If you think you're going to go to one of these clinics and they're going to McDonald's medicine you, that's not going to work. Okay, that works great in the beginning, and then it's just a great place to get drugs. And then you got to go to Testosteronology, and you got to have my information that I have on this new iOS and Android app just for you guys. And that's where it is. And you, of course, you have healthcare providers, and I'm training for you. But you have to have quality and ethical care. This is the bullshit world of these McDonald's TRT clinics. Again, we're working with them, but it has to come down to where it's traditional medical values. Let's keep going all over the world. So again, you understand, you add this. And these are injections. It's either going to be drostanolone propionate or it's an enanthate, one shorter acting. You have to go by feel. You add baby doses to it. You're not adding 200 to 800 milligrams a week of this stuff. That's bodybuilding doses. Those guys have to go. They're going to get crazy effects, and then they're shut completely down. There's going to be far-reaching spectrum of adverse health effects on that. Now, let's get into that. So you can see that these are, and I love the combinations of the world of the different medicines. This is the now and the future, but we just have to work with countries where it is legal. And you're going to stand by for more. And that's where I'm branching out into ethical, legal relationships with people in the world that have to understand that this is got to be something that's done properly for people and safe and sustainable. And doctors are coming on board. I can tell you that right now. So side effects. Hair. Let's go top to bottom again, guys. Hair. If this is a DHT derived drug, of course it's going to affect your damn hair. So if you don't like the effects of hair, suck it up, buttercup. Don't do it. Again, this is where the McDonald's medicine stuff. And if you think you're going to start using a polypharmaceutical regimen that's going to never be sustainable with dutasteride or finasteride, could it work? Do you have all these medicines you're popping, like this whole regimen that you're living on all these this is craziness. So, and a lot of genetics, a lot of men have genetics for hair that they're going to lose hair anyway. I've really seen this. I've really deep dived into this stuff. So hair, acne, again, you're adding synergistic steroids, even low doses. You're going to have effects on the hair and the skin. Let's keep going. The brain. I have to go into the brain. So there's a paradox here. You could have great effects when I'm bringing it to you, but I'm telling you, for years, men have phenomenal effects. And I'm going to talk about how there's downregulation and how they get around that in a minute. But there's going to be shut down. on top of the testosterone. I'm assuming you're on testosterone, you're already a mature man, hopefully the age of 23 or older, and you're already going to be like, I'm on testosterone forever. That's who this video is for. This is not like a steroid add-on that you need PC. We're not talking about adding fucking PCT on it. That's like, there's no PCT on this. I've been doing this regimen for years like this. No PCT. This is life. This is full-time life. You're my guy. If you're my guy and you don't want to have a heart attack, this channel and what I do for you in testosteronology, that's my creation. Melding internal medicine and androgens. So pay attention. CNS, you could have adverse effects if you have mood disorders. We're treating some great psychiatrists and some psychological people, some psychologists. We have the best here in testosteronology. I could tell you that this helps your focus, your concentration. You know, we got these Silicon Valley guys I've taken care of for years. They don't care about the bench press. They just care about their IQ and making tons of money, just bringing things to the world. They love this world. They love this world. They don't really give a shit about their hair. They care about their brain, but they will go in and out of periods of stress, anxiety, superimposed on your life. Hey, your wife sucks. Your life sucks. The money's not good. Come on, guys. So if you don't think this is going to affect your brain and there's going to be just full throttle, you're wrong. If you have underlying mood disorder, if you have ADD, ADHD, you think you have any mania, bipolar, boy, I've learned a lot from my testosteronologists that are in the real psychological world. Boy, this is, again, not the McDonald's medicine bullshit that these clinics, I'm putting an end to that. To the whole world, testosteronology is ending that. So again, the anxiety and the mania, it's multifactorial. But again, if you're working around that and the sex is good, your focus and your concentration, it gives a little hardness. This is, again, it's a secret. That's why I'm giving it to you guys. And you don't need anti-estrogens. Not the traditional not a SERM. You don't need the SERM, and you don't need the AI. This is the next level of where we're at in modern synergistic medicines in the world for biohacking. Not to mention, last piece here, cardiovascular. If it increases the damn blood pressure, you're gonna have to work around that, or don't do it. ABCDs, blood pressure, cholesterol. Oh yeah, you're adding synergistic androgens. To even small degrees, depending on you have the plaque in the artery. You have to know if you have plaque in the artery. Get a calcium score. Come to all the meetings on the app, the Testosteronology app. Understand your A, B, C, Ds. If you don't understand it, if you look in your heart the age around 20 or 30, 25 to 30, where it's going to be super conservative to see your heart, what's in your heart, this could worsen that. This is I've developed these protocols starting 20 years ago with massive pro bodybuilders, strong men and powerlifters, and just the average guy who just wants to lift big and be strong as shit. I developed protocols to protect on the cardiovascular and the renal system. I'm an internist. And now here I am. So again, A, B, C, but the D, I could tell you right now, I call it deposition disease, but it's really androgen-induced erythrocytosis. You could see all my deep dives in this. You could see thick blood video, and you could see that doctors don't be embarrassing and talk as if this is polycythemia vera. That's a fucking embarrassment now. Okay, checking JAK2 on 22-year-old men. Again, I could say it because I could say it. Okay, so this is androgen-induced erythrocytosis. There's a lot of genetics playing a role. It's genetic. People have you have genetics for this. You have any hereditary hemochromatosis, you're in trouble. You start adding any of these, boy. You have sleep apnea. You're pounding meats. You're getting that bad advice from all these different caregivers. You're going to be in trouble. That D is going to be a bear. You think that D and the deposition disease? You think you're just going to look at a CBC? Your H&H, hemoglobin hematocrit, and just dump blood all over the place? Wrong. What's going to happen is, if you're not looking at the iron studies, which I teach you guys well on, especially on the app and the meetings, you have to understand it for yourself, because the caregiver is not going to understand it. And the best doctors, even internists, they don't, even hematology doctors, I have found very humbling that they don't understand or care about this. the androgen-induced erythrocytotic effects for men that have to be on androgens. Okay, they're not steroid users. This is very complex with different types of thalassemic traits. This is very complex, but I want to let you know that if you have this, you're going to see just a spectrum of erythrocytosis that potentially can be dangerous. And I teach you all about that inside the app. That's just man per man. And it's man per man as far as you have to do it yourself and come to these group meetings. There's no man-to-man meetings in there. They're huge, massive meetings with me and with you guys. Tons of people learning. We even have women coming on board. We'll have special meetings for them. You need to understand to do this yourself. Yeah, I get emotional, guys, because I've been out there for a long time for you guys. And what I see happening is just ridiculous. You have to understand your ABCDs. You're going to use this kind of system. You're going to use this. There's no free lunch. For benefits that you may have and you may derive, you have to have protection and monitoring. Not just look at your labs, guys. Look at your labs. That's a fucking cringy. Now, look at your lab. What are you doing with your labs? What are you doing? What's going on inside your body? Do you understand it? Thank you. So, in the end of the day, you really can understand using this. And then, yeah, I'll close on this. Can you supplant and switch the DHT-derived drugs for sustained effects in the CNS, not to mention the sacs, with primobolan, proviron, every other week, every other injection? I'll leave you on that because there's more. We talk about this stuff all the time inside the Testosteronology app, appropriately, ethically based. So this is the new world, and understanding the synergy of these drugs is absolutely fascinating, and then to maintain your sustainable health. And that's why I'm here, guys. Thank you so much. Let's get a lot of comments, appropriate comments. Do you guys do this? Do you see it? The positive effects. How did you do it? What were your doses? Exactly what you did. Every comment from you guys. I really love you guys so much. Thank you so much for building me to the point to where we are today. I just want to keep crushing it for you guys. So please subscribe to the channel. We have Testosteronology channel just opening up, you'll see. And please give us a chance, on the Testosteronology app. It's on iOS and Android. Really see if we could help you. You can get caregivers that are actually on the outside on the directory now. Just have so much to show and to say to you guys. I really want you all to stay strong and healthy.